Where you have an ultrasound-guided breast biopsy, there are two main ways to do this. By far the most common and useful technique is a breast core biopsy. A breast core biopsy involves cleaning of the skin, localizing the lesion with ultrasound, putting in local anesthetic in the skin and then deep into where the lesion is, and then using generally a spring-loaded needle biopsy. Now, I'll do a separate video to show how this device works, but in general, it's a large gauge needle to get as much tissue as possible to one, pick up the lesion, and two, get as much tissue as you can so that the pathologist can accurately describe and diagnose the type of breast cancer or benign entity that might be present. With a spring-loaded core biopsy, the needle is placed against the abnormality and usually a 2 centimeter or 20 millimeter throw of the needle is put out through the lesion, and then a second part of the needle, which envelops the initial part, goes over the top of it, collecting with it parts of the breast tissue. That whole thing is then removed, and in the end you get a small thin string of tissue, usually 1 millimeter or 2 in thickness and about 20 millimeters long, and we place that in the solution which goes to the pathologist to make their assessment and diagnose what's going on. The other type of breast biopsy using ultrasound technique is a fine needle aspiration biopsy. This is less commonly done and has limitations, but can be a useful technique where a breast core biopsy is not possible. There are instances where the lesion is, the size of the lesion, makes it difficult to perform a core biopsy, in which case a fine needle aspiration can be performed. This is also particularly useful where it is considered that it's likely a benign cyst or other abnormality, which is mimicking something that is more abnormal. With a fine needle aspiration, what is usually done is the skin is cleaned, ultrasound is used to find the abnormality, a local anesthetic is injected, and then usually in my case 3 or 4 passes with a fine needle on the end of a syringe is done. That needle is more or less the same as a local anesthetic needle. It's a fine needle, and all that happens is the small cells in the abnormality make their way up the needle, usually by capillary action, which is to say they just make their way up the needle essentially by their ability to grab the sides of the needle. That small amount of cells is then put onto a microscope slide, and that's sent off to the pathologist to make their assessment. That's a fine needle aspiration biopsy.